I'm involved in treating bone cancer, particularly osteosarcoma, which is one of the most common solid tumors of adolescents and young adults. And there I'm the chair of the German, Austrian, Swiss osteosarcoma study group, and also principal investigator of the European and American osteosarcoma study. The current standard is treatment with both systemic treatment and surgery, about 10 weeks of pre-op chemo, surgery, and another 20 weeks of post-op chemo. And there are 3 drugs which are considered standard, and that's high-dose methotrexate, doxorubicin, and cisplatin. Maybe we can go back and take a look at what's happened over the past decades. So actually there has been a lot of progress as far as surgery is concerned. It used to be that affected patients lost their limbs, usually the osteosarcomas around the knee, and they were amputated. And there's been a major shift towards limb salvage, and so nowadays many people can keep their limbs. Chemotherapy is basically the same as it was 35 years ago, and there's been very little change. And so groups from around the world got together. In 2001 we started planning, and we've run a study in Europe and North America which accrued over 2,000 patients trying to improve things. And we were successful in running the study. Unfortunately, none of our experimental arms proved to be better than the standard. We are looking for agents which would warrant trials, and we've just had a meeting, a 2-day meeting here, a very exciting meeting prior to the ECHO conference, where the basic scientists, translational researchers, and clinicians got together trying to see which avenues we should take for further trials. But there's no osteosarcoma trial just ready to be opened at the moment. Not very surprising, everyone is talking about immune checkpoint blockade, and that's one way which might be going. I'm not sure really where we will end up. At the moment, the drugs that work are chemo, conventional chemo. Good cure rates, but still 30%, 40% in some risk situations, recurrences. And we'll need to build up on that. We cannot do without chemo, but we will need to see what we can add to that. So one thing which is important when it comes to this conference, multidisciplinarity, is that osteosarcoma is one of the tumors where pediatric oncologists and adult oncologists cooperate very well. So we have medical oncologists in the trial groups and pediatric oncologists in the trial groups, and that's the way forward for teenage and adolescent young adult cancer. I believe that that we need to work together across the specialties, and our Pediatric Oncology Society, SIAP Europe, has just written a European cancer plan for children and adolescents, and one of the 5 topics is that we need to get better cooperation with our medical oncology colleagues.